Hi viewers, I'm Dr. Sneha, your homeopathic doctor, and all are welcome to my YouTube channel. In this video, I'm going to talk about eczema. Eczema is otherwise called as dermatitis. Many people have used a lot of creams and ointments to get rid of eczematous rashes. They have used a lot of baths and they have used a lot of soaps, creams and all to get rid of the eczematous rash. So today in this video, I'll be talking about what is an eczematous rash, how it is caused, and what are its symptoms. So, the eczematous rash is nothing but small vesicular eruptions. What is vesicular eruptions if you ask me? It's a clear fluid-filled eruptions, right? These are closely packed in eczematous rashes. So these break open and these form thin yellow crust, okay? So this is the very characteristic feature of eczematous rash. Another distinguishing feature of eczematous rash and other rashes are that these eczematous rashes, when it comes in contact with any cloth or linen like we say, it stiffens the linen, means it makes it very hard to touch, right? It stiffens the linen. So this is the very characteristic feature of eczematous fluid, right? So these rashes can be categorized easily as eczematous rash when you have these features. So the next are the symptoms of eczema. What are the symptoms? It's redness, itching, and like I said, the yellow crust formation. The next thing is, where can we find these eczematous rashes, right? So the most common places that we can find these eczematous rashes are firstly on the scalp, right? On the scalp. Next would be on the forearms. The next on the face, right? On the face we can find it. Next would be the legs. The most common places are these. So we can find these eczematous rashes most commonly over here. Okay, so now we are going to talk about the causes of eczema. What are the main causes of eczema, right? So the first would be sedentary and irregular habits. Having a sedentary lifestyle, lethargic lifestyle, not having nutritious and proper food, not having the food on proper timing, maintaining a very irregular habit, not keeping a personal hygiene, personal as well as cleanliness, right? So you do not maintain any cleanliness and all. So you can have an eczematous rash if you are having a sedentary lifestyle. So the second cause would be in washerwomen who use a lot of washing sodas and soaps, right? Being in contact with all these chemicals can cause an eczematous rash. So the next cause would be masons or builders using a lot of lime, coming in contact of lime, like it is also called as chunambu in Tamil and chuna in Hindi, right? So being in contact with this can cause an eczematous rash. The next would be wearing tight and unaerated clothes. Wearing tight clothes which are not even aerated, which are very thick in nature and which do not allow the air to pass through. That can cause eczema. Wearing tight clothes which are giving you a friction, right? Even the shoemakers who sit for long hours together and stitch the shoes, right? They have to sit for a long time. So due to the friction of their thighs, it can cause an eczema. So using a lot of cosmetics can cause eczema. The next would be in painters. Painters who use a lot of solvents, also using an epoxy resin. They come in a lot of chemical contact, so that can cause an eczematous rash, right? So the next would be using the most common thing, okay? The most common would be using a lot of hair dyes. People, due to some cosmetic reasons, use a lot of hair dyes. They color their hair so that they look very gorgeous or they have a very dashing image, right? So they use a lot of dyes. This chemical can cause an eczema rash, right? So now in this video I have told you about the causes, about the symptoms and what is an eczema, right? So in the next video I'll be talking about some tips and tricks how to reduce an eczematous rash and also I'll be discussing about the treatment in homeopathy. And most interestingly, yes, I'll be telling you details of my case, right? The real eczematous case that I have cured. So stay tuned, stay updated. Do like and share it among your friends and family if you like this video. And also subscribe to my YouTube channel to stay updated for my videos, right? Thank you. Thanks for watching this video.